Everybody's been transitioning to the public cloud at some level over the past 5 to 10 years for multiple reasons. You go to a public cloud because it's easier to spin up infrastructure at times. It's easier to get storage. You don't have to worry about purchasing large areas of storage that you need to then allocate. It makes things easier. There's also technologies that are available in a public cloud scenario that people want to gain access to. And so it allows an easier change of your own internal processes, internal technologies, internal integrations. That being said, most institutions have their own private cloud for a long period of time. Now, that means that can be one of two things: their own physical data center that they own, or a private data center that they outsource to a third party. They're both called private because it's their own data center. It's their own equipment in it. And people move from one to the other in many different ways. Some of them decide to move as much as possible from a private to a public cloud because they think they're going to get the benefit, again, of the ease of the resources and the ease of procuring more hardware and more infra. What they don't take into account there is that applications that live in a private data center don't necessarily run the same way when they live in a public data center. And there's something called refactoring that needs to be taken into account. And many times, if you're moving one to the other, those that just lift and shift it all probably pretty much have a pretty straightforward application inventory, nothing too complicated. If you start talking about payers and providers that have a lot of different systems, both clinical, claims adjudication, whichever, they have to make decisions on what they move and when they move it. I think all healthcare systems are engaging in the cloud at some level today. It could be AWS, it could be Azure, it could be Google. Everyone has their own feeling for which is best, and they have their own challenges as well. The level of how they've migrated really comes down to the complexity of their application inventory.